Today, I will be sharing the findings of the survey ENN has done on maternal mental health support services for mothers of small and nutritionally at-risk infants. And this survey was done and the analysis was conducted by Eleanor Rogers, as well as by Ray, who was a nutritionist with the Emergency Nutrition Network. So I am presenting the results on their behalf today. So 36 people took the survey, and the survey was available in both English and French. But as you can see, the vast majority of respondents were in English, as we only had 2 French responses. And the people who responded were from a variety of different types of organisations. The majority of people were from international NGOs, but there was also representation from academic institutions, local NGOs, national governments, UN and civil society organisations. And so 40 countries were represented in the survey. So the majority of people were working in Ethiopia, South Sudan, Pakistan, India, and Kenya. All respondents noted that the maternal mental health support is really important in their context and is needed. And a variety of reasons were given for this, with the main reason that mothers face high stress because of low income, poor access to food, past traumas. People also reflected on the fact that the mother's mental health and mother's health is really closely tied to the child, and that mother's mental health is needed to be prioritised in order to combat poor child health and survival rates. And so 80% of respondents screened for maternal mental health, with a quarter of respondents using the MAMI Care Pathway package assessment tools. And other respondents use other assessment tools such as PHQ-9 or assessment tools where they didn't mention exactly which ones they were using. People also observed mother's behaviours, or they asked directly the mother how their mental health was and how they were feeling. So there were several challenges that came up regarding maternal mental health for mothers and providing the support. And these can be categorized into 3 main themes. The first was the lack of adequate mental health training for healthcare workers. The second was stigma around mental health. And the third was poor access to support services. And I don't think this will be any surprise to you, because I know that these themes were very prominent when we discussed maternal mental health in our Mothers and Mammy session a couple of weeks ago. And so on this slide, you can see some more details of exactly what people were saying. So I won't go into all the details of what's here, but the slides will be shared afterwards, and then you can read through the comments yourself as well if you're interested. I think some important things to pull out from this and interesting things is that under the lack of adequate mental health training for healthcare workers, it was also noted that there's a lack of training materials and support tools for staff, which I thought was interesting and something to take note of moving forward. A third of respondents directly provided psychosocial support services, with the most prominent service provided being counselling, followed by basic psychosocial support. So there were several challenges noted. Again, it was around, main challenge was around capacity and adequately trained mental health staff. There were also issues raised around lack of funding and lack of community support structures. But in the comments section, people also noted opportunities and also some strengths that they'd found in their own programs. So good communication about services to communities was noted as a really strong strength of programs, collaboration with ministries of health, also having a good understanding of the background and the context, and again, having experienced hospital staff in order to support the projects. So 87% of respondents referred mothers to services, with the types of services being referred to being support specialists, services that are in hospitals, as well as counselling. Some people mentioned referring mothers to support groups and home visits. So there were several challenges mentioned when people were talking about their experiences with referring mothers to support services. One of the main ones being the lack of quality and availability of specialised services. And I think this has kind of come up in this group again when we were talking about mothers and MAMI and mental health support service previously, and the question that it's hard to even screen mothers if there's no support services to then refer them to when problems are identified. And this really came through in the survey here. There were also issues around mothers not wanting to be referred to hospital facilities. And again, this is something I think this group has reflected on a lot, and the fact that quite often support services, there's high default rates, and also issues around stigma around mental health came out strongly. And then one programme noted that in their experience, they'd had a positive experience with referrals because the services were based in the same facility. So mothers didn't have to go anywhere else in order to get services, and that this was a real strength that they found in their programme. So different resources were being used in the planning of maternal mental health support services, and you can see the MAMI Care Pathway comes out quite strongly here as being one of the tools used in planning and implementation. And when asking people what additional resources were needed, training materials came out strongly, as well as service delivery materials such as guidelines, posters, counselling cards, and tools around capacity building for trained staff. And in the responses, I think it's also important to reflect that some of the respondents weren't aware of the MAMI Care Pathway, or they didn't feel that the MAMI Care Pathway resources were adequate enough. So of the respondents that had used the MAMI Care Pathway materials, which was about 50% of respondents, you can see that the majority of them used the MAMI Rapid Screening Guide, but closely followed by the other materials such as the counselling cards, the MAMI assessment forms, mental health assessment forms, and guides. And of the people who did use the materials, they did rate them as very useful. You can see the average score between being between 4 and 5, with 5 being very useful and 0 being not useful. So of the people who did use them, there was a positive response, with people saying that the guides and the counselling cards and assessment forms were concise and easy to understand, and that they were practical as well. But there was noted that they needed to be more simple, more understandable, and also they needed to be more specific. Lots of respondents also noted different adaptations they'd made to materials that they're using. So some had changed the scale in the maternal mental health support assessment, some had changed the terminology used in the forms, and there are also adaptations to do with making the forms more context specific and appropriate for the context and aligning it with existing protocols. And suggestions on how the MAMI Care Pathway tools and resources can be further improved. Again, as I said, it was around making them more simple, more easy to understand. There was a note that resources should be based on evidence or assessment. And also one person commented that the questions need to be revised. When asking respondents for additional resources, support, or tools they wanted for the MAMI Global Network, tools and materials came out strongly. We've already mentioned that people wanted training materials. There was also a need for guide for referral and enrolment, counselling guidance materials, support on how to contextualise materials, as well as a need for supporting documents and resources around the MAMI Care Pathway, maternal mental health resources. People also noted that they would like the MAMI Global Network to further facilitate partnerships and links, whether this is links with other organisations working in their context or working in similar areas, or for example, ministries of health. They also wanted the MAMI Global Network to further facilitate information sharing, so information sharing the 3 MAMI Global Network members. And there was also a request around funding and the want to know the latest information on different funding opportunities. And we also asked respondents for general experiences and reflections on providing maternal mental health support. And again, the capacity building and training came out strongly. But there was also the reflection that maternal mental health should be integrated into nutrition and health services and the need for this. There's a need for further education for mothers so that they see the value of psychosocial support, and also the need for financial support for mothers, among other things. And so that is the end of the results from the survey. I think that they're probably not surprising. They're very reflective, I think, of what we've discussed here as a group already. So interesting to see people's thoughts and comments and also what they would like moving forward. And one of the things I quickly wanted to do before handing back over to Marie was just to highlight some of the resources which are available in the MAMI Care Pathway. And one of the things that is available is a summary of different guides and different resources on maternal mental health support. And so this includes links to the MHGAP, for example, and different guides which are used to operationalise the MHGAP, such as Problem Management Plus and Thinking Healthy. There's also different initiatives summarised in there, such as the Friendship Bench, and different guides as well around providing basic psychosocial support for people that are not specialised in this area or are not specialised healthcare providers. And so all the resources are available on the ENN website, and I just wanted to flag that for you all. And thank you very much. I will hand back over to Marie.